Welcome to the RN Mentor Podcast. I'm Dr. Ali Tayeb, nurse, educator, advocate, and United States Navy veteran. This show is about real conversations with nurses moving the profession forward. We discuss leadership, practice, policy, research, and more. What matters and why it matters. I'm glad you're here, so let's get started. Hello, and welcome to another episode of the RN Mentor Podcast. I am extremely excited today to be joined by a colleague, Dr. Sabrina Ali Jamal-Eddine, is a health humanities nurse scientist, disability justice scholar activist, and spoken word poet. Dr. Jamal-Eddine completed her Ph.D. in nursing and certificate in disability ethics from the University of Illinois, Chicago, where her research explored the use of spoken word poetry as a form of critical narrative pedagogy to educate nursing students about disability, ableism, and disability justice. Dr. Jamal-Eddine is now a postdoctoral researcher in the Department of Disability and Human Development at UIC, where her research seeks to dismantle ableism in nursing education and practice through anti-colonial pedagogic strategies and community-based interventions rooted in the lived experiences of multiply marginalized disabled people. Dr. Jamal-Eddine serves as a 2024 Emerge Disability Justice Fellow through Paul K. Longmore's Institute on Disability. Dr. Jamal-Eddine's long-term goal is to found an applied public humanities community engaged healthcare equity center in a university that confronts healthcare inequity, violence, and oppression and promotes liberation, humanization, and belongingness for all marginalized patients, students, and practitioners. Welcome to the show, Dr. Jamal-Eddine.
Thank you so much for having me. I'm happy to be here.
I am so excited that you're on this show. We had an opportunity to meet at the DMPs of Color. We were on the same panel. I heard you do your spoken word poetry. So you are quite not only the nurse, a scientist, but also an artist. So I'm excited to kind of bring all of that to the show and put it all together and share it with the world. So welcome, welcome, welcome. I'm going to start with my first question, as I always do with a lot of my guests, is your origin story. How did you start it in the world of nursing?
Yeah, for sure. Thank you, thank you. So I started in nursing, basically before, while I was in high school, I underwent a 12 level posterior spinal fusion
Oh, wow.
that failed. And so I was left with 24/7 breathing pain for 2.5 years. And I had a lot of exposure to the medical field through my personal experiences with healthcare. Um, and I had a lot of nurses that were great, and I had a lot of nurses that were not great. And it totally like transformed my experience, or like so heavily impacted my experience in the hospital both times. I underwent a revision spinal fusion where they removed my 2 rods and 18 screws and put in a proper set of hardware. Um, so yeah, it like the nursing care just like completely transformed my experience. They were at different hospitals, it was different staff, and I still remember the name of the nurse from my first surgery that was just amazing. Her name was Kip. She like sat with me, and this is like over a decade ago, and I still remember like everything about that nurse because she just like, oh my gosh. I could tell she like cared about me as a human being and like knew how intense the surgery I just had was, and um just impacted me a lot. So that's how I was like, yeah, I definitely want to do nursing. It was kind of like in high school I knew like this is what I want to do. I've always been interested in care work and healing, and health in the human body. So I was like, this is the perfect profession for me. I know I can do this. I want to do this. So that's where it started. And then I went into, so basically, I took a year off in between high school and college to undergo my 12 level revision spinal fusion. Was approved to get a year-long medical leave of absence from my university. They held my scholarships, everything. That was amazing. Um, so the minute that I woke up out of that surgery, it didn't hurt to breathe anymore, but I still had basically acquired a disability from those surgeries.
Oh,
So like I have pain every day, and it's not 24/7, but it's still there, and I have to have accommodations and assistive devices to limit the pain that I'm in. I also have a connective tissue disorder, so that compounds it and probably impacts my experience with chronic pain a lot as well. So yeah, that process, like I went through the medical leave of absence, the revision surgery, applied to, did all the pre-nursing coursework, like a 1 year of pre-nursing coursework, worked extremely hard 24/7 in my room, like got a 4.0. I hear they get like 600 applicants per year for that program and only let in like 160. So it was like extremely competitive. Made it into the program, and then they at the bottom of every syllabus it asks you to come forward if you have a disability. I did that thinking that I could have an accommodation. Really, I just needed help lifting patients up in bed and like an accessible chair. And they were like, it was extremely punitive. They were
mm,
like, why did you enter a major you're not physically capable of participating in? What's next? You can't even lift an IV bag. And I was required to get a letter from my surgeon granting permission for me to stay in the program, even though I knew what I can do and what I can't do. Luckily, I had a surgeon that was like extremely uh like pro disability, I guess, like understands the worth of disabled people. He said, I have colleagues who are doctors in wheelchairs. I don't see why you can't do this. You don't want to do bedside nursing anyways. I don't know why they're telling you this. And then so he wrote the letter, and then my college brushed it under the rug like it never happened. They're so much better about giving didactic accommodations than they are at giving clinical accommodations. Like they gave me, I registered with Disability Services, no problem getting didactic accommodations, and then clinical, it was just like you're you're unsafe the minute that you mention that you need a clinical accommodation. They do not want to like touch it at all. They're scared of it, and instead of figuring out what to do about it, they dispose of students. This happens across the country, everywhere. It's not limited to any college of nursing. I see it everywhere. So then, yeah, I made it through the BSM program, realized that this was happening everywhere to so many disabled students and to so many disabled nurses who are practicing that are just getting disposed of by this profession and are also getting disabled by this profession, and decided to study ableism in nursing education. And I should mention, I double majored in women's gender and sexuality studies in undergrad, and that transformed my ability to articulate and understand systems of oppression, ableism, racism, classism, homophobia, sexism, transphobia, Islamophobia, like, and I couldn't imagine doing that undergrad nursing program without having women's gender and sexuality studies. I highly believe that every nurse needs to be critically engaged with systems of oppression in order to be in this profession, because nursing is not neutral. It is a political profession. And if you are not engaged with the political side of it, we're going to continue to have health inequities for forever. So that's how I got into nursing. That's what I do now.
that's awesome. I'm aware of some of your views around nursing, and I 100% agree. I've had a couple of my guests that have been on the show that have spoken about the exact same thing of how uh, unequipped our education in nursing is
Mhm.
in creating modifications or accommodations for nursing. And I think at some point, our education system mistakes their role in the world of nursing, where they see nursing as purely bedside, that I, as a
Mhm.
education system, need to prepare you for bedside nursing, where not necessarily in nursing in the profession of nursing, right?
Right.
And I think that's where the system is broken. That if you can't physically do something, all of a sudden you're not qualified, and
Hmm.
that is so like on the opposite side of where I think the profession of nursing needs to be. So yeah, our
Right.
system is just simply not equipped. And I think our schools of nursing in general, I'm generalizing, I'm sure there's schools out there that do a better job than others,
Hmm.
but in general, our schools are not equipped with the accommodations necessary for the clinical portion
Hmm.
of creating nurses that are clinical experts, that are critical thinkers, that are, you know, um, can push out the kind of students that we need to be transformative, as opposed to I need you to do these tasks, right?
Hmm.
Because the tasks are separate from, anything else. So
Hmm.
I 100% agree with you. And I love the fact that you brought up the fact that our profession actually disables so many of our nurses.
Hmm.
I can tell you from my own back pain that there is
Hmm.
a disability component, and that's
Yes.
primarily because I worked in the emergency room.
Hmm.
And God knows how many different times I probably hurt myself, and I was like, "Oh, it's part of the
Definitely.
job,"
Right.
but we're not really, uh, you know, we're not taking care of ourselves. We're not taking care of the professions the way we should be. So, I
Right.
greatly appreciate your voice in this whole process. Not my area of expertise, but I can acknowledge the fact that your voice is necessary in the profession. So, thank you for that.
Yes, of course.
So what did you do since you did have these, you did need these accommodations to, moving forward in your career? What was you finished your bachelor's degree in nursing. What was your next move in order to, because, I have to admit, I drank the Kool-Aid at some point of you need to have so many years in the world of, doing
Hmm.
bedside before you can do anything else, right?
Right.
I have since detoxed from that from that Kool-Aid. But for you, what was your transition into what else air quote workforce? What did that
Yes.
look like?
So my senior year of my nursing program, they created a new position at our College of Nursing that was the Diversity, Equity, and Inclusion Student Advocate. So I was employed by the College of Nursing through that. And that position was amazing. My supervisor was amazing. And I got to do a little bit of grant writing in that position. So basically, my women's gender and sexuality studies skills were like really coming through. My humanities skills were coming through in that position. And my supervisor was a person of color, and then my supervisor's supervisor was a PhD, a nurse PhD of color. And she was like, I've read your writing. You need to consider the PhD route. Like, I think you could do this. We need more women of color in this area because, like, as you just experienced in your nursing program, I went through my nursing program and only had one faculty of color that
Mm,
entire 3 years of the actual
yeah.
BSN portion. And I was like, yeah, that's wild. We do need more women of color here. And so yeah, then I applied. So my original goal was to be a women's health nurse practitioner. I did an externship at Duke University's cancer clinic while I was in my BSN program. And I learned a ton there. I got a ton of clinical hours, and had an amazing mentor there named Hansel, and I still remember him. He was dope. And yeah, that was a really awesome experience. So I got a lot of extra clinical in there from that. But I applied to the PhD programs with this idea that I had on like studying ableism and nursing education. Talked to a bunch of mentors at different universities. I got offered lots of full rides, and then just
Nice.
picked, it was deciding between University of Illinois Chicago and UC Irvine. They were both like amazing programs. And I went with UIC just to be closer to my family. And there's a disability studies program at this university. So I got to take all of my advanced coursework in this disability studies program and a critical pedagogy. They have a curriculum and instruction department for critical pedagogy. So it was the perfect program for me. I loved it. And yeah, it's been amazing.
That's awesome. That's awesome.
Yeah.
So through your PhD program, clearly you transitioned into your postdoc now. Let's
hmm
talk a little bit about your postdoc,
hmm
and what you're doing there and what you hope to get out of it.
Yeah, so my postdoc is in the Department of Disability and Human Development at UIC. So now I get to focus more deeply on disability and be engaged with all of these amazing like disability health researchers. So it has been wonderful. I have a lot of support here and I'm learning a lot. The postdoc is basically protected time to transition to the tenure track role, and I am learning so much about like NIH and grant writing and publishing and um, presenting my research at a lot of different places and collaborating on people's research projects. So it has been really great. And I've been working on publishing my dissertation, the different papers from that. So they're under review right now, and I've been working with some different groups that are doing research, the Access in Nursing program. We've done a benchmarking study on disability accommodations in nursing, so that's been really cool. So yeah, it's been great. And now I'm working on writing proposals on specifically on what I'm interested in currently is how access to disability focused critical consciousness raising and basically access to disability justice scholarship can impact internalized ableism and associated experiences of psychosocial well-being of disabled people. Um, Personally, as a disabled person, having access to like critical disability studies just like transformed my view of myself and my body and its worth after becoming disabled. Um, so yeah, I'm really interested in that. And I'm also interested in how access to disability-focused critical consciousness raising will impact healthcare provider decision making, um, and like on the bioethics side, medical futility decision making, genetic counseling, triaging, how quickly we triage disabled patients,
Mm,
and resource allocation during times of medical resource scarcity, so organ transplants, natural disasters, pandemics, COVID-19, who gets a ventilator? A lot of times disabled people are relegated, so yeah,
wow.
that's what I'm interested in.
Wow, amazing, amazing. I can tell you from just hearing you and the work that you're doing, the nursing profession is that much better for having you in it,
Oh, thank
right?
you.
So yeah, I mean, from a disability perspective, I can see nursing is great. I feel like, I'm generalizing, with bringing up the ideas of being inclusive of
Yeah.
individuals with disability, but the
Mm-hmm.
action doesn't always translate. The job descriptions don't always translate. And I
Mm-hmm.
sometimes feel we are so narrowly focused in the
Mm-hmm.
profession that we don't even realize the talent that we're missing by being
Mm-hmm.
sort of exclusive and not inclusive in the profession.
Definitely.
So I appreciate the work that you're doing. Um, So, but you've been, I'm going to you've been, you mentioned something that about nursing being political. I've said that for years, when Twitter was still around before it became X. That's something that myself and some of my colleagues shared those views quite a bit, that nursing is political because we have to
Mm-hmm.
be politically engaged. And you do have some engagement, and I've seen you, some of the work that you've done. That sort of social justice component, the disability
Mm-hmm.
justice component, I think runs deep in your work. How did, other than your own personal experiences, how did this the justice piece kind of shape who you are and the work that you're doing now? What other influences has there been to kind of push that sort of
Yeah.
towards your work?
I think the women's gender and sexuality studies major just opened my eyes to how
Mm,
all of these systems are so connected. Like every single system of oppression is so connected, and health is just absolutely in there, and access to healthcare, um, and healthcare inequities. You can't talk about any of that without understanding those systems. So exposure to like the writing of Black queer feminists and
mm,
scholars who like I'm reading every single day. There's not a day that goes by that I'm not reading someone's book about systemic oppression. Like there are so many brilliant scholars out there, and it applies directly to nursing. So I think nurses need to be engaging with the humanities. Like that's just a big part of it. And what bodies are being politicized, don't what bodies are deemed not worthy of care. Um, so that's been the biggest influence for me. And then just witnessing what I witnessed in clinicals, like I
yeah,
witnessed racism, I witnessed transphobia, I experienced racism, I experienced ableism. Like it's just to not to think that you can separate the quality of care you provide to someone from those beliefs of dehumanization. They're not political at all. We call them political because they're being politicized, but
right.
they're human rights. And I just witnessed that and was like, I can't believe this is happening. But it's happening. There's
Yeah,
people in the break room making fun of people of color's names that they're naming their children, like on the women and infant unit, and thinking that's not impacting the care. It's absolutely impacting the care that you're providing if you're in the break room making fun of people of color, or saying ableist things that like disabled women shouldn't be having children, like stuff like
mm,
that. Like it's gonna impact the care you're providing.
yeah,
So yeah.
yeah. You're making the wheels in my brain kind of start turning on some of the stuff that you're saying. Um, from your perspective, and having gone through the education system that you have, and looking at the nursing curriculum, what
Mhm.
would be, so let's put the education piece aside, because I think nursing education, it's so focused right now on passing the NCLEX,
Mm,
and reporting NCLEX pass rates. They've missed
mhm,
the mark on what is actually important in the work of nursing, right?
mhm,
And it goes and how that work actually contributes to safe patient care, right?
mm, mhm.
So just being able to do your 5, 6, 7, 8, 9, 10 rights of medication safety, whatever people are prescribing to these days,
Mhm,
it's how it goes beyond that into some of the things, the humanities component that
mhm,
seems to
mhm,
be missing. Like, uh, nursing seems to be missing the mark on how to connect the humanities component to the work of nursing,
mhm,
which I think is a huge missed opportunity in many programs, because I think faculty, having taught and having worked with some colleagues, I say, oh, they see humanities as a separate thing, that
Mm-hmm.
people take another course in to meet their uh, the college requirements for their degree, right?
Yeah.
And they
Mm-hmm.
don't bring that into the classroom, which I think is a
Mm-hmm.
shame.
Mm-hmm.
Um, but having said that, again, education aside, how would you say if I was a nurse and I went through the education system and I didn't experience the experiences that you had and wasn't exposed to the courses that you really immersed yourself in and allowed it to shape who you are now, what would be something I would need to do? Or what would be a first step for me if if you were advising me? What would be the first thing I would need to do in order to start walking that walk of integrating like really humanity into my
Mm-hmm.
work?
Mm-hmm. Okay, so I would first say, uh, before giving the advice, additionally, the cultural competency components of the nursing programs, and they're shifting towards cultural humility, but those are where we could definitely be integrating critical radical humanities of politics
Mm,
of humanization. That's a completely missed opportunity by these programs because they're being taught by people who do not have engagement with systems of oppression.
mm,
Back to there's very few faculty of color.
right.
And it can't just be a faculty of color. It needs to be someone who is politically engaged, and you can't just have black and brown faces there who are doing the same practices that
Exactly. Exactly.
uh, non-POC are doing, people of color. So, yeah, it needs to be people who are engaged with those systems of oppression and are engaged with the humanities. And then from the practicing nurse side, those yearly trainings that they have them doing are like checking a box off a list. There's no humanization component in them at all. It's like, watch these screens, answer these questions. All right, you're done. You're done for diversity for the year. And it's just like those are so ineffective. It's this constant checking off of a box
Yeah.
without any engagement with humans. So those are a space where like from hospitals could be actually engaging with art and the humanities to humanize um, marginalized patients. And with those classes that the students are taking, a lot of times we're fed this narrative that nursing is the hardest profession. Like there's no way we can engage with, we can't double major, we can't minor. Like it's too much. It's such a labor intensive major.
Yeah.
And it is very hard. Like this was hard, but I'm I I double majored and it's doable. Like
Yeah.
we're being fed a narrative that it's not doable to engage with humanities while doing nursing, and that's just made up.
Yeah.
Like I'm not exceptional in terms of like my ability to double major. I think anyone can do that. And it's there's so many missed opportunities to do it in the education system and then beyond. And so beyond, if your hospital is not engaging with humanities or narratives, humanizing narratives like spoken word poetry and that kind of thing, which is what my dissertation was on, um, I would say you can engage with those things. Like spoken word poetry is an amazing route. Like honestly, whatever medium of art makes you feel something that you connect to,
Yeah.
engaging with that, engaging with art that is created by marginalized people who are speaking about marginalization, who can let you into their world of what that experience feels like. Once you're able to feel what a marginalized person feels during these times of oppression, you're able to humanize them, empathize with them, and change your behavior. So, whatever medium speaks to you, I would urge you to tap into art. Like, it's not something that should just be on the margins. It should be part of your practice and engaging with topics that are politicized. I would urge doing that. And audiobooks, podcasts, um, reading Like
Yeah.
that's huge. That's what I would, that's how you learn.
Yeah. And I appreciate that. And I think the biggest thing that's, I think if I could take a theme from what you just said, is that component of engagement and being able to bring that content and relating it to your work,
Mm-hmm.
right? And I think so many of us kind of I don't want to say we're disengaged. And by we, I don't mean me, because I think I'm quite engaged in what's
Mm-hmm.
going on. But as a general, as a profession, sometimes it feels the profession is disengaged because we focus so much on the tasks, again, the tasks of nursing, as opposed
Mm.
to looking. And I think from you said you're not exceptional, I would say you are exceptional,
Thank
because
you.
you are not necessarily the norm of nursing. You have taken those
Mm.
extra steps in order to engage differently in the profession of nursing, which I think we need so much more of.
Mm.
Everybody says we have 4 million nurses, 5 million nurses, whatever the numbers are at this point. I'm like, yes, but of that 4 or 5 million, how many of us are actually engaged in the profession of nursing, as opposed to having the nursing be our 7 a.m., 7 p.m. job,
Mm-hmm.
right? Two
Mm-hmm.
different things. Being engaged and being a voice of nursing in having course corrections and what we're doing in the world that we live in, as
Mm-hmm.
opposed to I'm going to go to my job, my 7 to 7, and that's where I end being a nurse, as at 7
Mm-hmm.
p.m. or 7:30 p.m., whatever it is, or
Mm-hmm.
AM if you're a night shift nurse. So, but like all
Mm-hmm.
the like you're definitely someone who's moved away from, and that's one thing I when I talk to my students, there's so many pathways in the
Mm-hmm.
world of nursing. Actually, I'm going to be talking at a conference coming up in a couple of weeks. And that's the thing that I want to really talk about is like we get fed this narrative, as you mentioned, uh,
Mm-hmm.
and we just don't know when you're going through school unless you have other people saying, hey, yes, this is a narrative, but there's these other narratives also. There's other
Mm-hmm.
possibilities in the profession. We just don't
Right.
expose unfortunately, we don't expose our students enough to
Yeah,
that.
we don't.
Yeah, which is one of the reasons I created the podcast. Is I
Right.
know there's a number of universities that feed into this. I use the podcast in my own coursework, and just to make sure that my students understand there's an entire world beyond bedside. Nothing wrong with
Mm-hmm.
bedside. Bedside is the meat and potatoes. We have to. Nursing is the foundation of care when it comes
Mm-hmm.
to bedside, community nursing, all that stuff. But I think being able to see beyond the job, I think, is what's key.
Yeah, and I think because bedside nursing is experiences the harshest labor conditions and the most
Absolutely.
disablement,
Yeah.
the hospitals are facilitating the narrative of you must do bedside in order to do anything else. It's kind of
Oh,
like do
yeah.
this and then maybe you can go do something else instead of addressing those unjust labor conditions that make nursing really tough to do bedside. Because I remember
Yeah.
when I was in the BSN program, they would have people from the local hospitals talk to us and they would say, you will not get any, you're not going to get an outpatient job until you've done 1 year of med surge. And I
Yeah.
went up to I was like, well, I have a back disability. They're just like, oh, I don't know why you're here.
Yeah,
Like,
it doesn't make
it's
sense. That doesn't make.
so,
I work for
yeah.
an FQHC now that
Hmm.
we've created. The organization has created a pathway from a new grad pathway program into ambulatory care, right?
Mm,
It's those narratives exactly as you mentioned. Like you have to do bedside inside of a
right.
hospital before that. I'm like,
And
no,
and
that you
those narratives
don't.
are there for a reason. They're
Yes,
serving the institutions and not
I
the
agree.
humans. So,
I agree. And unfortunately, a lot of the people in the world of nursing have grown up with that narrative and they
hmm,
continue to perpetuate that narrative because it's all they know within the
right.
world of nursing. And that's why I think some disruptions in the system need to be had in
Hmm.
order to sort of course correct what the ability of the nursing profession in making change. I think
Hmm.
that's where the narrative definitely needs to shift. So thank you for
Right.
that.
Yeah.
One of the things I want to definitely bring into this, you mentioned your spoken word poetry and some of the, I know you dabble a little bit into playing instruments and things like that. Um,
Mm-hmm.
let's talk about the art piece of this that you have integrated into your work.
Mm-hmm.
And I know I asked you if you can share one of your spoken word poetries. I would love to hear that and then talk more about this art piece of your work.
Yeah. Um, yeah, should I go ahead and
Yeah,
share it
please,
now?
please.
Okay.
And this is if you can give us a little background about
Yeah.
this particular piece and where you had the opportunity uh, to
Yes.
share it.
So, the poem that I'm gonna share is called I Want You Back. It is a poem that I wrote on societally induced self-hatred of minorities, Islamophobia, xenophobia, racism. And it was really about my experience growing up with those things. And then I also mentioned nursing in it, so that's why I want to do this one. But I did this. Um, it's probably like 6 years old now. I did it for a TEDx talk at my university, and which was an amazing opportunity. And I had so many amazing opportunities at the university. And so, yeah, I was the only undergrad student when I did it that was selected for it. So that was awesome. And
That's amazing.
it was like for a audience of about 1,000 people.
Wow,
And yeah, so I can go ahead and share it.
please.
All right. It's been a while since I've done this, but let's give it a try. Okay. This is called I Want You Back. Oh, baby, give me one more chance to show you that I love you. Won't you please let me back in your heart? Oh, baby, I was blind to let you go, baby. Now that I see you, it is on. I want you back. You see, I was 5 years old when 9/11 happened. And don't get me wrong, America has always had racial and religious factions, and xenophobia has always been visible like a closed caption. I mean, European immigrants are the only ones welcomed into our nation with compassion. Imagine always having to represent your entire race and religion, because you are your peers' only Arab interaction, and rather than using an encyclopedia or academia, we rely on the only three images fed to us by the media: a hijabi, a blood-drenched war baby, or a terrorizing assassin, maybe sprinkle in a little Aladdin and Jasmine. Imagine every year on September 11th, from 1st through 8th grade, your school essentially stopped its studies for a day, but rather than actually acknowledging lost lives, they would show us propaganda filled video archives that demonized and dehumanized Arab and Muslim lives, painting us as if we are only comprised of submissive women and thirsty bearded guys holding machete knives, dropping bombs from planes who daydream of multiple wives, and then directly after showing us those videos that subconsciously made me wish the race could be a choice. Next, a monotone voice would come in over the intercom, requesting a moment of silence, eliciting in me conflicting internal violence. My heart would never keep quiet. It'd be pounding with paranoia while my peers were meditating, breathing hatred in through their noses, olfaction blowing microaggressions out through their mouths. Government satisfaction, political distraction to sanction retaliation for oil infractions, like a mental vortex meticulously inscribing prejudice into each vulnerable cortex. And if the teacher ever heard a word, he'd say, shh, no talking. Hush, little baby, don't say a word. Even if you speak, you will stay unheard. It was at that point that society taught me how to be a mockingbird. Locked inside a metaphorical cage at a really young age, I learned that my race was better left a mystery, considering what I saw every day on the news and in that class that we called history. I hated the word Arab growing up so much that I would respond to my daily racial interrogation by saying I'm Arabian or Mediterranean, something that emanated a little less Satan and a little more white like chocolate macadamia, while my female peers had sweet European middle names like Elizabeth and Marie. Mine was always Ali, prefacing my equally foreign last name Jamal-Eddine, which seamlessly fused together Arab, Black, Muslim, and immigrant, four of society's most detested discriminants. I hated the Jamal so much that I actually cried back in junior high when my school forced me to use my full legal name. My teachers were too white to realize that leaving that part out was my means of escape, like a 12-year-old injecting localized lidocaine and expecting numbing of the systemic pain from the trauma of being randomly checked and detained prior to boarding any plane. I must have been ashamed of my dad's accent and immigrant status, because I made my primary apparatus asking my white mom to attend parent-teacher conferences and pick me up from school. Society must have made Islamophobia look kind of cool. I would never let my friends over to my dad's house, not because it was so small, but because artwork of Islamic calligraphy painted every wall. Nothing could compete with the smell of sauteed onion, not even Febreze aerosol perfume protocol, because my family does not season its food with scentless butter, salt, and cholesterol. I refused to learn Arabic and erased every trace of race from my linguistic memory. When I was 5, I made my mom return the tan Barbie that looked like me for a blonde one with blue eyes, because that's what I thought was pretty. I used to straighten my hair every day, incinerating my curls, attempting to blend in with the white girls. Back when I used to give a shit, I would literally chemically burn the skin above my lip to bleach the peach fuzz, leaving little cuts that stung like a whip. I used to hate the little bump on the bridge of my nose, my Arab exposed. I'd watch my self-esteem decompose. I delete any pictures of me taken from the side. I was out here trying to separate race from my body like an internal apartheid. They say beauty is pain. I say no. Beauty is the degree to which brown people are able to assimilate, while white people have the privilege to appropriate. What you think happens when your actions teach kids you are inherently a disgrace, that non-white means this is not your space? Like, who put you here in the first place? Like, dear white boy in the 9th grade, please continue to call me a terrorist to my face. Like, that white Christian patient asking my race and religion. I swear that question must be an addiction, an extension of the human condition. He said, it's okay that my family is Muslim. Like, thank you, sir, for your permission. Like, that nurse I was shadowing saying that all Arabs must have thoughts of terrorism in the backs of their heads, and having every single person in that room leaving that verbal message unread, having not one person to defend me. Your silence means you agree. If I wore a cross around my neck, would you treat me like a human being? We dress up prejudice and call it politics. Brown children are testaments that racial hatred is a crucifix. Being a minority in America means that when one person of your race commits a crime, it eats away at the moral sanctity of your entire race like a reputation enzyme. But with white people, it's always just one time. It means we are subjected to a life of double standards. It means we're too dark, but you can use a sunless tanner. It means we need to control our frizz, but you can use a volume enhancer. It means brown Muslim women's hijabs are oppression, but white Amish women's bonnets are never in question. It means it's called terrorism when a brown boy runs over one person, but calling a white man who murders 58 would be a linguistic perversion. It means ISIS is Islam, but the KKK is not Christianity. That even juxtaposing those two would be profanity. It means calling Michael Jackson crazy for his racial transformation rather than the nation that induced his actions. Oh, baby, I was blind to let you go, baby. Now that I see you, it is on. I want you back. I'm angry that I'll never get my childhood back. I'm frustrated that refusing to learn Arabic has resulted in me spending the last 29 years of my life being deaf and mute around my family that I chose to keep my mind destitute. that my teta died in Beirut, and our conversations were never able to go beyond "Iktir helwe, you're so beautiful, you're so cute." I'm heartbroken that all minoritized children don't have access to higher education to learn what grades 1 through 12 don't teach. So now all I got is my story to preach. I'm sorry that I did not recognize how brave my dad was to travel over 6,000 miles alone from the slums of Dahia, Berja Barajni, when he was 18. Because our family could only afford to send one out of 8 siblings to America to earn a degree. Sometimes it's difficult to decipher between the American nightmare and the American dream. I'm sorry that I did not show my dad or myself the love that we both deserved. That it took me 19 years to reclaim Arab as my main identifying word. That it took me 19 years to love my middle name because it's badass like Muhammad Ali, float like a butterfly, sting like a bee. To love my whole name, Sabrina Ali Jamal-Eddine, because it got that flow like nothing else I ever seen. To love everything about being Arab and everything about being me.
Wow. Wow. Amazing. Amazing.
Thank
Um,
you.
I teared up in the middle just because there's so many of the things that you mentioned, like I can relate to
Mm-hmm.
being from Iran and immigrating to the US. Some of the
Mm-hmm.
you we are on two different parts of the US experiencing some of the exact same things.
Mm-hmm.
9/11 specifically, I had just 9/11 happened 6 days after I left the Navy. And I
Oh.
had, after serving 10 years in the Navy, I had neighbors that wouldn't speak to me,
Mm,
knowing that I had just left, got out of the
right.
serving in the Navy. Um, so, wow, amazing, amazing. Thank you. Uh, thank you for that.
Yes, thank you for letting me share it.
Yeah. And I'm privileged because I'm an audience of one, which we'll be sharing more, but I'm an audience of one and got to hear it in person. So
Yes,
thank you for that.
of course.
Should have started with that for the podcast because then we could just take it all over the place.
Right.
Um, how does somebody how does somebody engage in this kind of work?
Mm,
Right? Like, what was your like? I know what your motivation has been, but how does somebody start down this path of incorporating the arts? Because you have other artistic uh,
mhm.
outlets as well. How important is the arts to your work? Let's just put it that way.
Yeah, so I started out with studying ableism in nursing education and doing like a qualitative
Yeah.
metasynthesis on that. And one of the biggest gaps in the literature was one, there are very few disabled people of color making it through because of
Mm,
those multiple layers of marginalization. It's luck when we're able to make it through, because we have all these other factors that are weighing in with not having people there to support you and advocate for you and make sure you get through. Um, but another gap in the literature was how ableism is just so deeply embedded in the medical profession. And there's so little education on it at all. So then I went the pathway of how do we educate nurses and healthcare providers about disability and ableism. And I looked up, has spoken word poetry been used at all in this? Because that's my personal expertise. I have access to, I started, I got into spoken word poetry in undergrad through my women's gender and sexuality studies major. They incorporated one spoken word poem into the class, and that was the first time I ever heard or seen it before. And I was
wow.
like, this is 3 minutes, and I just cried. I cried like no other medium can make me feel something so intensely, like chills on my arms, up my spine, goosebumps, and tears in my eyes just within 3 minutes of hearing somebody's story. It's like this massive experience of like transfer of emotions and humanization that I hadn't experienced anywhere else. So then I was like, I know of this pedagogy. It's a
Mm,
pedagogy, and let me look at how it's been used. And really, the only places that it's been used is in like high school and English classes, using it. Um, so yeah, so then did my dissertation on looking at the use of spoken word poetry to educate nurses about disability, ableism, and disability justice. And I learned so much about how students respond to spoken word poetry. Like this is a really important pedagogy. Um, and how like nurse educators need to be incorporating the arts and diverse pedagogies into their classrooms, because I didn't even ask this question, but across all 20 participants in the study, they were talking about how we have lectures for 6 hours a day where we are being read slides. We come
Yeah,
into class and we just have people reading us slides, and it is so hard for us to maintain focus, um, that like we want to learn, but it's hard for us to learn. And they were talking about like when you did so for part of my dissertation, for a qualitative descriptive study, I did a spoken word poem on my experience with ableism and disability and having a non-apparent disability. And they said when you came into that was the first time where we heard this room of 112 students completely silent. Every single person was listening to you. It demanded attention, and it also like impacted us so much. Like, and I got to delve into that. But it's just like there needs to be art in nursing if you want, especially if you want to achieve a process where nurses are humanizing marginalized patients, then you need to tap into humanization, and you cannot tap into
yeah,
humanization through slideshows
yeah.
and through these checking off boxes on these read about racism. No, you can't do that. You need to pick a medium that taps into humanization. This is one of them.
Yeah. And I think with that, this has been a sort of a theme with people who are really engaged with education. Kind of comes up quite a bit. I think part of it has to do with we have people with expertise in their specialty area
Mm,
who
hmm
are teaching about the specialty. However, they don't have a specialty in teaching, right?
mm,
They
hmm
don't necessarily know how to teach other than what they've been exposed to, which tends to be, unfortunately, here's a slideshow. It was prepared by
Yeah,
the person that wrote the book. Here's the
right.
book. I'm going to read you the slideshow. We're going to have a test because that's what you're going to get at the end of the semester for your final. And that's how your NCLEX or your national board certification or whatever it
Right.
is. We're so test focused that we missed this so much. And
Yes.
I wish nursing would listen more to the fact that we need more specialists with a specialty in education as well to
Yes.
communicate what we need to communicate in the world of nursing.
Yeah, I was really surprised when I entered the PhD program that that was how it worked. It was just like you get this degree and then you become a teacher. And I was like, well, we
Right.
haven't taken any coursework on how to teach. So I took multiple classes in the curriculum and instruction department, and I
Yeah,
learned about it, but I'm like, a lot of these teachers aren't taught how to teach.
exactly. Exactly. And it's a shame. And it's a shame. Um,
Mm-hmm.
but I want to be very, I know we're already for you, we've already gone over our allotted time. So I want to make sure that I'm cognizant of your time. So thank you. I think I can talk to you for days. Amazing
Yes.
work. Um, Anything else you want to share while I have you here?
Um, yeah, I guess just to recap, engage with bodies and body minds that are politicized. Don't be afraid of engaging. Like, this is the duty of nurses. Um, Care work is political, and um, specifically with like my expertise in the way that disability is manufactured. Like a lot of care work and healthcare and nursing is healing to compensate for those systems those unjust, violent systems that are disabling and harming people and making them sick. And it's a lot of times certain marginalized communities that are experiencing that. So the act of healing is always political, and we have a job to engage with that. So that's what I'll leave it at.
Thank you so much. Again, amazing. The profession is that much better with you in it. So thank you for
Yes.
being.
Oh, I will add one thing.
Yes, please.
Yeah, uh, I'm starting a Disabled Nurse National Solidarity Collective that's focused on multiply marginalized disabled nurses. So if anyone is interested in tapping into that, I want it to be like a political, critical consciousness raising space. So yeah, I'll
Do
send
you
you the
have
links.
Yeah, please. Anything
Yeah,
you send me, I'm more than happy to share it on the website,
perfect.
so people can access you, your work. Again, thank you for sharing your spoken word. That was amazing for me personally,
Thank
and
you.
your work and your work is amazing. So thank you again. We've been listening to Dr. Jamal-Eddine. Um, Amazing work. Can't wait to see what's next for you. So
Thank you.
appreciate
Thank
it.
you so
Thank
much
you.
for having me.
And I want to thank our audience for joining me and Dr. Jamal Adine today, and looking forward to bringing you more incredible nursing colleagues.